Understanding healthcare systems and their impact on patient care. Introduction to healthcare delivery systems. Welcome to healthcare delivery systems and their impact on patient care. Understanding different healthcare models helps nurses navigate complex systems and advocate effectively for patients. Today's learning objectives include comparing different healthcare delivery models, understanding system impacts on patient access and outcomes, exploring current healthcare policy trends, examining global healthcare approaches, recognizing the nurse's role in system navigation. Healthcare delivery systems are frameworks for organizing and providing healthcare services, each with unique strengths and challenges affecting patient care. Health Maintenance Organization (HMO) model. HMOs represent a managed care approach with specific characteristics. Structure and organization. Network of contracted healthcare providers. Primary care physician serves as gatekeeper. Referrals required for specialist services. Emphasis on coordinated, managed care. Key advantages. Lower costs for patients and insurers. Strong emphasis on preventive care services. Coordinated care through primary care management. Predictable costs and covered services. Potential disadvantages. Limited choice in healthcare providers. Possible delays in accessing specialist care. Geographic limitations on provider networks. Prior authorization requirements for services. Impact on nursing practice. Focus on health promotion and disease prevention. Care coordination across multiple providers. Patient education about system navigation. Advocacy for appropriate referrals and services. Preferred Provider Organization (PPO) model. PPOs offer more flexibility while maintaining some cost controls. Structure and benefits. Network of preferred providers with negotiated rates. No primary care physician requirement. Direct access to specialists without referrals. Coverage for out-of-network providers at higher cost. Key advantages. Greater flexibility in provider choice. No referral requirements for specialist care. Coverage options both in and out of network. More patient control over healthcare decisions. Potential disadvantages. Higher premiums and out-of-pocket costs. Less coordinated care between providers. Patients responsible for care coordination. Complex billing and reimbursement processes. Nursing implications. Patient education about network providers and costs. Support for patient decision-making about care options. Coordination assistance when patients see multiple providers. Advocacy for cost-effective care choices. Accountable Care Organization (ACO) model. ACOs focus on coordinated care and quality outcomes. Structure and goals. Groups of providers working together. Shared responsibility for patient populations. Focus on quality care and cost efficiency. Financial incentives tied to performance outcomes. Key advantages. Patient-centered, coordinated care approach. Financial incentives promote quality outcomes. Emphasis on population health management. Integration of services across care settings. Potential challenges. Complex administrative requirements. Providers assume financial risk for outcomes. Requires significant care coordination infrastructure. Performance measurement and reporting demands. Nursing role in ACOs. Care coordination across multiple providers. Patient education and self-management support. Quality improvement initiative participation. Population health management activities. Impact on patient access and outcomes. Healthcare system design significantly affects patient experiences. Access considerations. Geographic barriers. Rural areas often have limited provider networks. Transportation challenges affect appointment attendance. Telehealth services help bridge geographic gaps. Mobile health units serve underserved areas. Socioeconomic factors. Insurance coverage affects care accessibility. Out-of-pocket costs influence treatment decisions. Income level impacts ability to pay for services. Employment status affects insurance options. Cultural competency. Language barriers require interpretation services. Cultural beliefs influence healthcare utilization. Diverse provider representation improves access. Community engagement builds trust and utilization. Quality of care and health outcomes. Different systems produce varying quality and outcome results. Preventive services. Systems emphasizing prevention achieve better long-term outcomes. Regular screenings detect problems early. Health promotion activities reduce disease burden. Patient education supports self-management. Care coordination. Integrated systems reduce medical errors. Communication between providers improves outcomes. Care transitions are smoother with coordination. Patient safety increases with systematic approaches. Patient satisfaction. Quality care delivery increases patient satisfaction. Access to needed services improves patient experience. Cultural competency enhances patient comfort. Communication effectiveness affects satisfaction levels. Healthcare policy and reform trends. Current trends are reshaping healthcare delivery. Affordable Care Act, ACA, impact. Expanded insurance coverage for millions. Increased access to preventive services. Pre-existing condition protections. Medicaid expansion in participating states. Benefits achieved. Reduced uninsured population significantly. Improved access to essential health benefits. Enhanced consumer protections. Increased focus on quality measures. Ongoing challenges. Rising healthcare premiums and costs. Rural hospital closures and access issues. Political uncertainty affecting stability. Implementation complexity across states. Value-based care movement. Healthcare is shifting from volume to value. Core principles. Focus on high-quality, cost-effective care. Patient outcomes drive reimbursement. Prevention and wellness emphasized. Population health management prioritized. Provider incentives. Financial rewards for quality outcomes. Penalties for poor performance measures. Shared savings programs encourage efficiency. Quality measures guide improvement efforts. Nursing's critical role. Care coordination and case management. Patient education and self-management support. Quality improvement initiative leadership. Population health monitoring and intervention. Health information technology impact. Technology transforms healthcare delivery. Electronic health records, EHRs. Enhance documentation accuracy and completeness. Improve care coordination between providers. Reduce medical errors through decision support. Facilitate quality measurement and reporting. Telehealth services. Increase access to care, especially in rural areas. Enable remote monitoring of chronic conditions. Provide convenient care options for patients. Support specialist consultations across distances. Data analytics. Improve population health management. Identify at-risk patients for intervention. Support evidence-based decision-making. Guide quality improvement efforts. Global healthcare systems overview. Examining international systems provides valuable insights. United Kingdom National Health Service, NHS. Publicly funded universal healthcare system. Free care at point of service delivery. Government-employed healthcare providers. Strong emphasis on primary care and prevention. Strengths. Universal coverage ensures access for all. Cost-effective population health outcomes. Strong preventive care focus. Reduced financial barriers to care. Challenges. Long waiting times for non-urgent procedures. Limited resources strain system capacity. Aging population increases demand. Political pressures affect funding levels. Germany's healthcare system. Germany operates a multi-payer system. System structure. Statutory health insurance for most citizens. Private insurance options available. Multiple insurance funds compete. Government regulation ensures coverage. Key strengths. Universal coverage with choice of insurers. High-quality care with good outcomes. Strong preventive care emphasis. Patient choice in providers. System challenges. Rising healthcare costs pressure sustainability. Rural areas face provider shortages. Aging population increases service demand. Complex administrative requirements. Canada's healthcare system. Canada provides universal coverage through provincial programs. Medicare system features. Publicly funded universal healthcare. Provincial administration of services. Private delivery of most services. Portable coverage across provinces. System advantages. Universal access regardless of income. Strong primary care foundation. Good population health outcomes. Financial protection from healthcare costs. Ongoing challenges. Long wait times for elective procedures. Limited coverage for dental and vision care. Rural and remote access challenges. Aging population strains resources. Comparing global systems. International comparisons reveal important insights. Universal versus private systems. Universal systems ensure broader access. Private systems may offer more choice. Mixed systems attempt to balance both. Outcomes vary based on implementation quality. Prevention focus. Scandinavian countries excel in preventive care. Strong primary care systems improve outcomes. Population health approaches reduce disease burden. Investment in prevention yields long-term savings. Healthcare spending. United States spends most per capita. Other developed nations achieve similar outcomes with less spending. Efficiency varies significantly between systems. Administrative costs differ substantially. Nurses' role in system navigation. Nurses play crucial roles in helping patients navigate complex systems. Patient advocacy. Help patients understand their insurance benefits. Assist with prior authorization processes. Connect patients with financial assistance programs. Advocate for appropriate care within system constraints. Care coordination. Facilitate communication between providers. Ensure continuity across care settings. Support transitions between different systems. Help patients access needed services. Education and support. Explain system processes and requirements. Teach patients how to access services effectively. Provide information about available resources. Support informed healthcare decision-making. Navigating healthcare systems successfully. Understanding healthcare delivery systems enhances nursing practice effectiveness. Remember, different healthcare models have unique strengths and limitations. System design significantly impacts patient access and outcomes. Current policy trends emphasize value-based, coordinated care. Global perspectives offer insights for system improvement. Nurses play vital roles in patient advocacy and system navigation. This systems knowledge will help you advocate effectively for patients throughout your nursing career.